Hello? Hello, naririnig niyo po ba ako? Okay, sige, let's start. So, our topic for today is pharma nursing. Okay, so this is divided into two parts, meron tayong Pharma 1 and Pharma 2. Pharma 1 natin would be discussed today and tomorrow. Ang Pharma 2 is, I don't know kung kailan yung Pharma 2, pero Pharma 1 is today and tomorrow. So, these are the following topics that we will be discussing. No? Fundamentals of pharmacology, legal ethical considerations, and medication administration. Okay, sige, let's not waste time. So, fundamentals of pharmacology. When it comes to NCLEX, we have to understand that medications, pharmacology, mga drugs natin, they have a lifespan consideration. No? They have a lifespan consideration. Okay? So, it means that pag mga bata, no, these medications are usually individualized. It's highly individualized. We usually use the parameters of their age and weight. Pero kung tatanungin ka, what would be the best parameter, no, to individualize medication sa bata? Is it age or weight? It's weight. Very good, no? Weight. That's why later, no, pag mag-aano na tayo, magso-solving na tayo, weight is used pag nagka-calculate tayo for pedia calculations. Okay. Aside from that, no, kapag mga pedia, yung ating pinag-uusapan, the best route is oral route. No? The best route is oral route. Okay? Pero meron tayong mga do's and don'ts dyan. Okay, so sa oral route natin, ito yung do's natin. So let's change color para mas ano siya, ma-highlight. Let's use color blue. Yan, do. Do offer choices. Do offer choices. Especially to toddlers. No? Toddlers and preschoolers. Bakit? Because toddlers and preschoolers, mahilig sila mag-no. That's their form of negativism, di ba? They like to say no. So, to prevent them from saying no, when you offer medication, offer ka ng choice. Would you like to drink the medication in the red cup or the blue cup? So, instead of saying no, sasabihin niya, red cup. So, iinumin niya pa rin yung gamot. Okay, next. Do offer liquid. Okay, do offer liquid medication. So, if you don't have if you have an alternative for syrup, no? Kunyari, tablet. Pinescribe ng paracetamol na tablet. Pero merong alternative na syrup form, mas best liquid form ang hahanapin natin. Okay? Or syrup form. Okay, so yan yung mga do's natin. Mga don'ts na naman. Don't, no? Don't force a child to drink medication, no? Forcing a child to drink medication can lead to injury. Additionally, tort law violation din 'yan, 'di ba? Pag na-threaten mo ang bata, sige, inumin mo tong gamot or else ganito ganyan. Anong tawag doon? When you verbally threat a child to drink a medication, anong tort law violation 'yon? Yes, assault. You are performing assault, no? What if pinilit mo, hinawakan mo yung kanyang bibig tapos nilagay mo yung gamot? Anong tawag na dyan? Battery na, because there is physical touch. So that's why you do not force a child to drink medication. Next, do not refer to meds as food. No, wag mong sasabihin, take this kasi lasang candy. Okay. Anong stage of development? Yung highly imaginative. Na pag sinabihan mong candy, ha, candy, candy. Imagine nila lahat ng gamot candy na. Anong stage of development yun? Preschoolers. No? Especially among preschoolers, tell them it's candy, they think all the medications are candy because they are highly imaginative. Okay? And also, do not mix medication with food. No? For example, hindi mo nabibigay yung tablet. So, plano mo, dinikdik mo, tas hinalo mo sa meatball. No? So, ginawa mo ng aso yung bata. So, don't mix it with food. Okay, next. Kung hindi kaya oral, IM yung binigay, pwede lang din. You can give IM medications as long as you know the route. It's your vastus lateralis. Now, ito yung route natin for pedia medications. Now, kung IV naman, so pwede pa rin as long as you give it very slowly. No? Give it slowly. Because if you give it too quickly, it increases the toxicity. Pangit yung color ko, sorry. It increases the toxic effect of the medication. No? Pag masyadong mabilis. No? Yan. So that's why it's very important na naka-infusion pump or yung pediatric infusion pump pag nagbibigay ng gamot sa mga bata. Okay. Sige, next. Another lifespan consideration natin is mga buntis, pregnant clients. Okay? So, the only thing we need to remember here is that not all medication can be given to a pregnant client because there are certain medications that are considered teratogenic. No? Tatandaan natin, when you say teratogenic, this medication can cross the placental barrier and harm the developing fetus. Okay? So, choices of drug is usually based on the state of pregnancy. What trimester is teratogens most dangerous? It would be your first trimester. Because during the first trimester, this is where organogenesis occur. Organogenesis. So therefore, pag first try si mother, marami talagang gamot na bawal sa kanya or hindi pa din mabigay. So your nursing intervention is before you give medication, always counter-check with the physician, no? Kung tama ba yung gamot na ibibigay. Okay? That's just for your pregnant patient. So ano yung mga teratogenic na mga gamot? Okay, so ayan na. No? We will not discuss all of them because usually nadi-discuss naman to sa OB nursing natin. So ayan na, nakasulat na dyan. Okay, sige, next na tayo. Next, sa mga matatanda, another lifespan consideration sa elderly. Now, when it comes to elderly, patandaan natin as we get older, everything slows down. Lahat bumabagal. Okay? Because lahat bumabagal, yung mga GI system natin bumabagal, yung mga renal system natin bumabagal, we cannot eliminate medication substances in our body as effective as before. Hindi na kaya. Okay? And therefore, when it comes to elderlies, you have to start the dosage small, mababa lang. Usually, 1/2, no? Doon sa recommended dose. And it is titrated until there's a response, a therapeutic response. Because elderly patients have increased risk for toxicity effects. No? Because they can no longer eliminate it to renal system. Mabagal na. Additionally, another problem with your elderly clients is your polypharmacy, no? Polypharmacy. They are taking too much medication and they don't remember it anymore kung ano yung mga nainom nila. And therefore, our combat against that is we have to perform your medication reconciliation. Okay? Medication reconciliation. So what is this medication reconciliation? This is ensuring that the medications that the patient needs to take are up to date, no? Up to date medications para hindi sila masosobrahan. Okay? So this is our combat against polypharmacy. And usually, polypharmacy, the manifestation of this one is neurological impairment, delirium. A patient who has been taking elderly patients na maraming iniinom, they have delirium, no? Or lucid intervals of, tawag yan, lucid intervals of mga change in consciousness and mentation. Isa yan sa mga first sign of polypharmacy. So when the patient becomes confused, no, nawawala, nalilito, it could be because marami na siyang iniinom na gamot, lalong-lalo na sa mga matatanda. Okay. Next tayo. Another consideration that we need to take into consideration would be your cultural and ethnopharmacology. So, We took NCLEX nursing because we are going to the melting pot of the world in USA, di ba? Sobrang daming races doon, no? So, when it comes to different races, iba din yung manifestation ng mga gamot nila. For example, African Americans are less responsive to beta blockers and ACE inhibitors. So, when an African American develops hypertension, and hypertension is very common in their blood, no, sa race nila, hindi sila binibigyan ng beta blockers or ACE inhibitors. Instead, they are started with calcium channel blockers, so, no, the big guns of antihypertensive medication. Aside from that, they are also given diuretics to control it, to control blood pressure. Yan. So, hindi sila nagre-respond sa beta blockers and ACE inhibitors. What about Asian Americans? So, Asian Americans, this talks about East Asian, ha? Yung mga Koreans, Japanese, Chinese. Asian Americans have lower percentages of body fat, which means fat-soluble vitamins are not absorbed properly. Therefore, when we're giving fat-soluble vitamins sa mga Asian Americans, it has to be adjusted. Adjusted fat soluble soluble, no, vitamins. Okay? Kasi hindi nila na-absorb agad. And lastly, for Hispanic Americans, they require a lower dose, no? They require a lower dose of TCAs. Okay? Because ang TCA sa kanila, they experience higher effects of mga higher side effect ng mga TCA na yan. Okay, so these are just some lifespan, some cultural consideration when it comes to pharma. Okay, so any questions before we proceed? Any questions before we proceed? So if you have any questions, please chat nyo lang, no? Tinitignan ko lang dito sa cellphone ko kung may mga tanong. Okay? So no questions, okay. No questions, let's proceed. Okay, sige. Let's answer the following. Okay? A 54-year-old man brought his 2-year-old granddaughter for her vaccination. He stated that the child's mother had to go to work, so she took her instead. Okay, so at 2000, the client observed, okay, at 2000, the client observed to be active and interacting well with the grandfather. A client is for yearly flu vaccine. Vital signs was taken, height and weight, measurement documented. Vaccine administered and health teaching is done during the clinic visit. Vital signs as follows: temperature is 37.8, RR 70, heart rate 110. During the assessment, select the following nursing actions that are appropriate or not appropriate for the client. Number 1, allow the SO to wait outside to promote privacy during assessment. Is this correct? This one is not appropriate because privacy is meant for adolescent patients. Okay, next. Assess the breathing pattern and respiratory rate when the child is calm. Appropriate or not appropriate? This one is appropriate because as we understand, if the patient is crying, diba, respiratory rate, heart rate can increase. Administer flu vaccine IM via the anterolateral thigh muscle. Is this appropriate or not appropriate? This one is appropriate. What is the anterolateral thigh muscle? This is another name for your vastus lateralis. Okay, so take note, no? That's what NCLEX likes to do as well. Okay, paborito yan ni NCLEX. NCLEX likes to use different words to mean something else. For example, anterolateral thigh muscle. That's just another name for vastus lateralis. Okay, next. Advise the SO to give the child 1 tablet of paracetamol if fever occurs after vaccination. Appropriate or not appropriate? This one is not appropriate because you should not advise the SO to give a tablet. Find a liquid preparation. Additionally, 2 years old has a higher risk for aspiration and poisoning. That's why we want liquid preparation. Next, teach the SO to offer cool flavored drinks or popsicles prior giving syrup medications. Appropriate or not appropriate? Anong answer nyo dyan? This one is appropriate. Because cool flavored drinks or popsicles are able to numb the mouth. And once the mouth is numb, they cannot taste the bitterness of the medication. No? As I've said earlier, do not mix together. So this one is not mixing because you offer it before giving the syrup. So prior. Okay? Next, encourage the medication adherence by offering oral vitamin supplements that are chewable and sweet in flavor, as they can be likened to candy. Appropriate or not appropriate? This one is not appropriate because we should never, tawag yan, we should never address medications the same as food, as they can be likened to candy. So they are like candy, di ba? Bawal. Okay? Any questions? Naintindihan ba? Yung iba, any questions? Understood. Okay, let's proceed. Okay, let's answer this one. An 80-year-old client who has been diagnosed of having sundowning syndrome. SO states that the client is alert and oriented during the day but becomes disoriented and disrupted at around dinner time. He is hospitalized for evaluation. Client had a history of alcohol abuse with brief psychotic episode 20 years ago and an episode of angina pectoris 3 years ago. Client is currently diagnosed with DM type 2, dyslipidemia, secondary hypertension, and stage 1 liver cirrhosis. SO states not being familiar with client medication and hands the nurse various papers of medical prescription stating they belong to the client. So, ito daw yung mga gamot. Now, these are the medications that was observed by the nurse. Patient was taking metformin, atorvastatin, amlodipine, losartan, aspirin, nitroglycerin, and escitalopram. Lab results reveal AST, that is 60, which is high. Okay. Complete the diagram by dragging from the choices below 1 potential condition, 2 actions the nurse would take to address the condition, and 2 parameters the nurse would monitor. Okay, what potential condition do you think the patient is experiencing? Is it a brief psychotic episode, hepatic encephalopathy, polypharmacy, or senility dementia? Very good. It's letter C, polypharmacy. How did we know it's polypharmacy? Well, because patient has a delirium, no? Patient has delirium. Additionally, you can tell all of these medications that come from the various papers of medical prescription. So, definitely the patient is taking random medications na. Letter A is not the answer, no? Brief psychotic episode, because a psychotic episode should manifest with hallucination, delusion, illusion. So walang hallucination, delusion, illusion. There is just disorientation and confusion. Okay. Letter B is also incorrect because hepatic encephalopathy should to know that there is hepatic encephalopathy, you have to monitor serum ammonia, and we don't have any evidences for that. And lastly, it's not senility dementia because dementia is chronic. It does not happen at night, no? When there is no more light. It's not the same as your sundown syndrome. Dementia is from the moment you wake up until you go to sleep, for the rest of your life kasi chronic na siya. So letter C is the correct answer. So knowing letter C is our potential condition, which two actions should we perform to treat letter C? Okay. Anong answer? It's letter D. Perform medication reconciliation. And letter A. Ensure safety. No? Ensure safety. So, maintain proper hydration and nutrition status. No? This is not our answer because there is no hydration or nutrition problem with our patient. The problem is he is taking too much medication and he is showing signs of delirium. So therefore, you perform medication reconciliation, and after that, you ensure that during times of lucidity, he is safe. Okay. So what should we monitor to assess the client's progress? Very good. Monitor your medication scheduling because you already perform medication reconciliation, and vital signs would be enough. Okay? So no need to monitor dementia because your client is not demented. Delirious lang. No need to monitor serum ammonia level because it's not hepatic enceph. It's polypharmacy. No need to monitor psychotic symptoms because your patient is non-psychotic. Very good. You got the right answer. Okay? So any questions so far? No questions. Okay. So these are different sources of medication. So as you can see, medication can come from a lot of things, from plants, animals, minerals. Okay, comes from a lot. We don't really care, but it's just there. Okay. Next topic natin would be pharmacokinetics and pharmacodynamics. We will not focus or bother ourselves with pharmacokinetic. What we should, however, focus in is the pharmacodynamic of things. What the drug does to the body. No? What are the therapeutic effects of a drug? What are the side effects, the adverse effect, the toxic effects? That's what we should be focused on. Now, what are the different effects of these drugs in our body? So let's discuss about the side effects, adverse effect, toxic effects, and teratogenic effects. Tatandaan natin, when it comes sa NCLEX pharmacology, the key to passing it is to know the side effect and the adverse effect. We do not focus so much on the therapeutic effect because physicians are the one focusing on the therapeutic effect. They are the one prescribing the drug. As nurses, we are the ones monitoring the effect of the drug. So we are monitoring if there are side effects, adverse effects, etc. Okay, so side effects. These are unintended effects that occur within the therapeutic range. Are side effects expected or not expected? Are side effects expected or not expected? They are expected. Okay. Should you discontinue a medication if there are side effects? Answer is no. Do not discontinue because it is expected. So therefore, what would be your nursing intervention if there are side effects of the medication? You monitor. Aside from monitoring, ano pa? You teach the patient. Very good. You teach the patient about the side effects, how you can manage it. You just manage the side effect. For example, anticholinergic medication such as atropine causes the mouth to dry. So if the patient starts to complain, why is my mouth always dry? Of course, you will not report that to the physician. That's just the side effect of the medication. So you teach the patient how to manage it. You tell the patient to use ice chips, Drink water, increase OFI, use sugarless gum, etc. You manage the side effect. No need to report it to the physician. Okay, next. Adverse effects. These are life-threatening effects that occur within the therapeutic range. Are adverse effects expected or unexpected? They are unexpected. Should you discontinue once adverse effects come out? Yes. Should it be reported to the physician once adverse effect? Yes. So that's one of your nursing intervention. Report to the HCP. No, report to the doctor. Okay? And also perform your mga tawag yan, life-saving procedures. No? Life-saving procedure. For example, one of the adverse effects of digoxin is severe bradycardia. So therefore, when you notice that the patient has a heart rate of 40, you don't have to think what you would do next, because the next thing that you would do is just to report it immediately. Okay? And of course, to stop the medication. Okay, next. Toxic effects. Toxic effects are potentially life-threatening. So when you say potential, it can or it can't. We don't know yet. It's potentially life-threatening effects that occur beyond the therapeutic range. Should you discontinue if toxic effects show? Should you discontinue? Well, the answer is yes and also no. No? So toxic effect, usually these are medications with narrow therapeutic index. No? Narrow therapeutic index. So these medications should exist at a specific range. For example, lithium. Lithium should exist between 0.6 to 1.2 in the patient's blood. Greater than 1.2, toxic effect starts to show. And that is why it's both a yes or a no. Because medications with narrow therapeutic indexes has a lot of gray areas. No? Meron silang mga gray area. Again, same example, lithium. Lithium 0.6 to 1.2. The gray area of lithium is 1.5. So it does not mean that the patient has a lithium level of 1.5, you have to discontinue it immediately. As long as the patient is not showing signs of life-threatening symptoms, you do not discontinue it. So it's both a yes and a no. So what is your nursing intervention? You have to monitor the therapeutic range. Therapeutic range. To monitor your therapeutic range, you have to monitor your top, your trough and peaks. Aside from that, there are certain laboratory parameters that you need to focus on. No? For example, let's go back to digoxin. Digoxin also has a narrow therapeutic index. No? 0.8 to 2 nanograms per ml. But when you're giving digoxin, you have to monitor potassium, because the lower the potassium, the more fatal digoxin toxicity can cause. No? Not just lab parameters, you also have to monitor the vital signs. Now, there are vital signs that is associated to your not to certain medications. Okay, and last, teratogens. So, should you discontinue teratogens? Of course. No? Yes. Ba? So, I don't think we need to discuss why you should discontinue that. Okay? So, any questions with this one? So, take notes sa ating mga words, no? Side effect, the adverse effect, toxic effect, and teratogens. We will be using this as we go along with our discussions in NCLEX Pharma. So, any questions so far? What is TAP? That will be our next discussion. Okay? So, TAP. TAP is your trough, administer, and peak. Trough, administer, and peak. TAP is what we do with medications with narrow therapeutic indexes. So these are just some examples of medications with narrow therapeutic index. But this is the most commonly tested, no? So let's write it down. These medications, no, which has narrow therapeutic indexes are the most tested in NCLEX nursing. First, we have your lithium, no? We have your digoxin, we have your phenytoin, no? And then we have your theophylline, and lastly, we have your anticoagulants. Okay? This is the most commonly tested. Itong lima, no, these five. Later, no, as we go along, we will be discussing all of these medications. I'm just giving it a preview. Okay, so going back, trough administer peak. Trough is the lowest concentration of the drug inside the patient's body. Peak is the highest concentration of the medication in the patient's body. That's why we say tap, because you have to check the trough before you administer. Check the trough before you administer. After you administer, you check the peak. Okay, so the question is, when do you check trough, no, or and what time do you check peak? Okay, so again, trough is acquired before administration and peak is acquired after administration. Trough and peak are not medication dependent. No? Checking the trough and the peak are not dependent on the medication. Trough is always drawn 30 minutes before the next dose. However, it can change per hospital policy or per doctor's order. But the standard is you check the trough 30 minutes before the next dose. While peak, no, you check the peak depending on the route of administration. Okay, depending on the route of administration. Because different route will have different peaks. Different route will have different peaks. For example, if you give a medication sublingual, or you give catapres sublingual, the medication will peak 15 to 30 minutes once the drug has dissolved. So if you want to check the peak level of catapres, you wait 5 to 10 minutes after the drug dissolves. Then you will see the highest concentration of that medication. Okay, next, IV. IV peaks at 15 to 30 minutes once the bag is empty. So not when you start the infusion, when the bag, no, the IV bag is empty. Then you start counting 15 to 30 minutes from that to determine the peak of that medication. For IM, that's 30 to 60 minutes once the plunger is empty, no, the syringe is empty. For sub-Q, now sub-Q is special because subcutaneous medications, they are the only ones drug dependent. No? They are the only ones drug dependent. For your per orem, oral medication, it's no longer necessary because it cannot be um, determined properly. So take note ha, peak is not drug dependent. It is route dependent. It means that if you gave morphine IV and you gave morphine IM, IV morphine will peak faster than IV IM. Okay? Because IV morphine peaks 15 to 30 minutes once the bag is empty. Okay? So any questions with this one? Any question? No question? Naintindihan? All good? Okay, very good. Sige, let's answer this one. You give 100 ml of a drug at 200 ml per hour. The drug takes 30 minutes to run. If you hang the drug 10 a.m., it will finish running at 10:30. When will the drug peak? Is it number 1, 10:15, number 2, 10:30, number 3, 10:45, or number 4, 11. Three or four. Oh, you can only pick one. Pili ka lang ng isa. Three or four. Okay. So we have three, we have four, no? People don't know. They're picking between three or four. So let's put a star on that one. So when did you start counting? Did you start counting at 10 a.m. or 10:30? Kailan kayo nag-count? Sa 10 a.m. or 10:30? Very good, 10:30, because you start counting once the bag is empty, once the drug has finished running. Okay. So, according to our discussion earlier, when will IV medications peak? Kailan nagpi-peak ang IV medication? 15 to 30 minutes once the bag is empty. So, 10:30 plus 15 minutes, 10:45 or 11 o'clock. It's between 10:45 or 11. Correct answer is number 4. Teka lang, why is number 3 not a correct answer? Diba 10:45 is still within. So ganito yan siya. When you encounter peak questions, no? When will this medication peak, etc. Always go for the highest. No? Always go for the highest without going over. That's the tip, no? When you encounter peak questions, pick the highest without going over. Okay, so that's why the correct answer is number 4. Okay, any questions? Okay, no questions? O, sige. Now, this one, no, is just an example on how it could look like, no, mga trough and peak. Okay? Pero this is a psych question, no? Psych question. This is a psych question. So I will just be using this as an example on how trough and peak questions can look like for NGN. Okay? So a 34-year-old client with bipolar 1, no, security caught client in a sexual act with 2 newly hired groundskeeper. Client states, "No one can resist me, I'm a sex goddess." Client was led to her room and was intermittently observed by nurses. Client refused lunch and dinner. At 0100, loud noises Loud noises was heard in the client's room. Client is still awake. She stated that she no longer needs sleep. Client was observed writing multiple paragraphs in different pieces of paper. Client stated, "I am writing a novel. It needs to be published." Okay. So, lab results show na dehydrated si client. Sodium is low and trough lithium is 1.5. So, before administration, the lithium amount, no, the lithium level sa blood ni patient is already quite high. So in NGN, sometimes they do this. They give trough lithium, or sometimes they will say peak lithium. So from the name itself, you should have understood, was the drug administered? Okay, so when you encounter trough lithium, was the drug administered? No, yes or no? Nakasulat, trough lithium. Was the drug administered? Not yet. No. But if it was written there, peak lithium, was the drug already administered? Yes, because peak is acquired after administration. So that's why we use that app. Okay. So the question here is, what potential condition the patient has? So I'll just answer it kasi psych naman to. The answer is letter C, manic. Letter D is incorrect. The patient is not underdosed because the trough lithium, the amount before the medication was administered was already quite high. Nasa 1.5 na siya. Okay. So, now what would be your nursing intervention? The answer is letter A and letter B. Now, ensure client safety and maintain proper hydration. Now, letter C is incorrect. Because, again, trough lithium is quite high, so don't administer. So, mali siya. Okay. And what would you be monitoring? What you should be monitoring is letter B and letter C. Okay, letter B and letter C. You should not be monitoring the peak lithium because peak is monitored when you administer lithium. Okay, peak is monitored when you administer it. So letter B and letter C would be the best answer. Okay, so that's why we had to discuss trough and peak. Any questions? Any questions? No questions. Okay. So next topic natin would be legal and ethical considerations when it comes to pharmacology or sa ating mga medications. O yan. So complete medication prescription. Do we still need to discuss this? I don't think so. So just read it on your own free time. What is a medication prescription that is complete? No? And because of NGN, no? Because of new generation NCLEX, we don't need to bother ourselves with this one because in the case study, doctor's orders are always complete. No? So nakasulat na dyan lahat. So for the sake of discussion, complete medication prescription should contain patient's name, no? Date and time, the medication given, no? It should be written in generic instead of yung generic instead of brand. Dosage of the medication, the route, time, frequency, and the signature of the physician. For verbal and telephone orders, ganon pa rin, no? Date and time received, document order stated by HCP, red back order, so usually, no, if you're still using paper, you would have a stamp. You stamp it for red back, and then you sign that stamp. Okay? But if you are using EMR, electronic medical record, there is just an option that you click and then red, na red back order. So something like that. And then sign the order, no? And then dapat you should acquire co-sign within 24 hours. Okay, so that is what a complete medication prescription should look like. Okay. Other legal and ethical consideration would be your pregnancy risk category. Okay. So, siguro you have encountered this before, yung FDA pregnancy risk category natin, yung ABCDX. This old pregnancy risk category compared medication with animal use. No? Medication and animal use. So, was it tested on animals? Was it tested on human, etc.? So slowly they are trying to remove this one, this old pregnancy risk category. Now they are trying to implement this pregnancy and lactation labeling final rule. No? This pregnancy lactation labeling final rule, no, or yung PLLR, this one is more complete. And not only does it cater females, it also caters males. No? Both male and female, tinutulungan tayo. Okay, ng PLLR. So, the topics in your PLLR, no, sa medication yan would be pregnancy. Is this medication teratogenic? Yan. Next, lactation. Can this medication cross, no, or can this medication be excreted to the breast milk if I'm nursing, no, if I'm a nursing mother? No? And lastly, female and male reproductive potential. Can this medication make me impotent? Or does this decrease libido? No? Or worse, does it affect contraception? So that's why it's becoming, no, better than your pregnancy risk category kasi mas kompleto na siya. It targets pregnancy, lactation, and reproductive potential for both males and females. Okay? Next would be your controlled substances. Yung mga illegal medications natin. Okay. So controlled substances, first natin would be PEDs. PEDs or performance enhancing drugs. So these are medications that are being abused no, to increase activity performance, usually related to sports, no, usually tied to sports. So these are different types of medication, no, that you may encounter in NCLEX. They might start asking this. Okay? Usually, the question here is, which of the following individuals uses this type of PED? Okay, so for example, anabolic steroids. No? Anabolic steroids are commonly used by mga physique competitors. Yan, bodybuilders, ano pa, no? Strongmen, physique competitors. Okay? Next, no, stimulants. Stimulants, they wake you up. Common use of stimulants are for endurance sports. No? Sports that not tell you to be in a bike for a very long time, or you have to run in a long distance and you need to be awake. Yeah, next. Human growth hormones, HGH. No? Again, these are used by physique competitors such as bodybuilders, ano pa, strongman athletes, etc. Next, your EPO, erythropoietin. No? EPO is again abused by endurance sports such as cyclists, no? Or long distance runners to continue production of red blood cell, for red blood cell to continue oxygenation. So maraming oxygen na nasa circulate. Another PED, no, performance enhancing drug, would be your painkillers. Okay, painkillers, mga analgesics. Painkillers are abused by fight sport. No? Fight sport. So, they are abusing this one so they don't feel pain during their fights, such as boxers, no? MMAs, whatever. Next, no? Ang next natin would be your sedatives, such as benzodiazepines or anxiolytics. Who do you think would abuse a medication? Which sport would abuse this one? They want to be calm. Being calm, no, enhances performance in their sport. Who do you think abuses this? Any idea? Gamblers? Sport ba yun? Hindi yun sport ang gambling. Grabe ka naman. It's your professional chess players. No? Professional chess players. Yan. Board games, hindi naman sport ang board game, no? Chess players na lang sabihin natin. So professional chess players abuses sedatives and anxiolytics to be calm during their games. So aside from chess players, mga professional archery, ano ba? No, professional archery. So the more calm they are, the more they can, no, perform well. Okay, so these are just some of the common medications, common performance enhancing drugs that are being abused, no, to enhance performance. So you might encounter these types of question. At least you know, no, how do you, no, so you know how now which athlete abuses them. No, that's the common question naman. Stimulants can increase concentration. Well, that depends, di ba? Patients who are already stimulated and they take stimulants, no, they become concentrated. But patients who are not stimulated and they take stimulants, they become hyperactive. So, iba yung effect. Okay? Okay, so yan, mga common lang to na mga tinatanong, no? I could remember that when I took NCLEX, this one came up sa akin, no? The question was, which of the following sport would abuses erythropoietin? And the correct answer was cyclist, which is an endurance sport. No, cyclist yung nag-abuse. So you might encounter some similar question. Okay, aside from PEDs, no, performance enhancing drugs, we will also discuss your uppers and downers. your uppers and downers. So most medication, most substance that are being abused is either an upper or a downer. Nandiyan lang yan sa dalawa. It's either an upper or a downer. So, an upper, no? Examples natin for upper medication, and ito lang yung kailangan yung ma-memorize. Just memorize these 5 upper. Are your caffeine, cocaine, PCP, methamphetamine, Adderall. Okay, 5 lang. If it's not either of the 5, then downer na yung tanong. No? Downer na yung medication agad. Okay? We will not memorize all the downer medications because there is so much downer medications out there. No, there is over 160 plus downer medications, and I don't think we have the time or energy. But definitely, we can memorize 5 upper medications: caffeine, cocaine, PCP, meth, Adderall. Caffeine, cocaine, PCP, meth, Adderall. Okay, so what are the intoxicating effect of an upper medication? From the name itself, upper, everything goes up. Lahat tumataas. So, when you're taking cocaine, what would you expect? Bradycardia or tachycardia? Tachycardia. When you're taking caffeine, what would you expect? Lethargy or restlessness? Restlessness. When you're taking methamphetamine, what would you expect? Jail time or death? Oh, no, I almost got you there. So when you're taking meth, what would you expect? Would you expect constipation or diarrhea? Diarrhea, because your GI system is so fast, it's moving everything. So everything is going up. Everything is so up that your brain starts to fire a lot of electrical signals. That's why you start to have a seizure. No? And that's why patients who are abusing upper medications, you have to expect or anticipate suctioning because they will have a seizure when they overdose. Okay? Now, when they stop taking the medication, when they stop it abruptly, everything goes down. No? When you are withdrawing from an upper medication, lahat bababa na. So, your patient is withdrawing from methamphetamine. Which would you expect? Insomnia or hypersomnia? Your patient is withdrawing from a methamphetamine. Which would you expect? Insomnia or hypersomnia? Walang tulog or tulog ng tulog? Answer is hypersomnia, because everything is going down. If your level of consciousness is going down, you're always asleep. Inaantok ka. Your patient is withdrawing from PCP, acid. What would you expect? Respite depression or seizure? Respite depression, because everything is going down. Your patient is withdrawing from Adderall. What would you expect? SVT or heart block? Heart block, because everything is going down. And now you're getting it. Proud of you. Okay, next. Sa downer naman. Okay? When you're taking a downer medication, its intoxicating effect is everything is going down. So from its name, your patient is abusing Xanax. What would you expect? Lethargy or restlessness? Lethargy, because that's the intoxicating effect of downer. Your patient is taking xylophane. What would you expect? Euphoria or depression? Depression. No? Even if you don't know the medication, you can already answer it. No? Kasi alam mo, no, if it's not the 5 upper, whatever I'm saying, it's probably a downer. And you're not wrong. Your patient is taking OxyContin. what is the intoxicating effect? Would you get a DTR of 4 or a DTR of 1? A DTR of 1, because OxyContin is a downer, and a DTR of 1 means deep tendon reflex are decreased. Okay, very good. So when you take downer, you take it so much, everything is going down, you anticipate intubation and ventilation because the patient will undergo respiratory arrest. No? That's what we're expecting. Now, you stop taking downer, you stop taking the medication, you're going to have a withdrawal. The effect is opposite na naman. You are having an opposite effect. No? So, your patient stops taking Prozac. Your patient is withdrawing from Prozac. Would you expect muscle tension or muscle relaxation? Muscle tension. Very good because everything is going up na naman. Okay? Sige. Any questions with this one? No questions? Very good. So, all your substance abuse, no? Lahat ng mga substance abuse questions, you can now answer them with least effort. Okay? So, let's continue. Other medications that needs to be monitored would be your high alert medications, no? Yung tinatawag nating HAM. High alert medications are the ones that belong to a pinch. Ayan, a pinch. Anti-infectives, especially your aminoglycosides, no? Aminoglycosides are the one that ends with the word mycin, di ba? Tulad ni vancomycin, streptomycin, bleomycin. All of these mycins are dangerous to your ears and to your renal system. So they are nephrotoxic and ototoxic. Next, potassium and other electrolytes. Yes, no? Electrolytes that are concentrated are dangerous. Insulin, because insulin can cause hypoglycemia. Okay? Narcotics and sedatives such as morphines, oxycodone, no? Methadone, it should be handled by a specialized nurse only. We call them as your pain nurses. Okay, next, chemotherapeutic agents and heparin and other anticoagulants. All of this medication belongs to a pinch. So, high alert medication, no? Because they are dangerous and they can kill a patient, it's very important that before you administer, you perform your independent double check. So what is an independent double check? It means the medication is checked by another nurse. Okay? So two of you checks the medication, no? The medication, the dose and the route. So this prevents, no, any adverse effect from occurring giving these high alert medications. Okay, let's answer the following. A 56-year-old client was discharged from the acute psychiatric unit 2 months ago with a diagnosis of PTSD, anxiety, and clinical depression. Client was taking Zoloft. Upon readmission to acute psychiatric unit, it has been noted that the client was also taking Ativan and Xanax. Based on the physical assessment notes and data collected during the nurse interview with the client, indicate which of the findings demonstrate that he is experiencing either withdrawal or intoxication. First and foremost, what type of substance are we talking about here? Is this an upper or a downer? Very good, no? You don't need to memorize it. Automatically, it's a downer. It's not caffeine, it's not cocaine, it's not PCP, meth, or Adderall. It's a downer. Okay, sige, let's answer the following. Okay, spouse reported that the client to have fallen, twitching, and had foaming on the mouth. When you are twitching, are you withdrawing or intoxicated from the medication? Mm. Okay, sige, ulitin natin ha. Downer. What is the if what is the intoxication effect of a downer? Is it going up or going down? It's going down. Okay, very good. Going down. Keep that in mind. If you are twitching, is that symptom going up or going down? If you're twitching, that's going up. So is it an intoxication or a withdrawal? It's a withdrawal. Very good. Next. 5 days prior consult, the client states that he was always asleep and couldn't differentiate his day and nights. Is that a withdrawal or an intoxication? It is an intoxication because it's going down. It's a downer. Okay, appears to be shaking during the interview. Hyperrhidosis noted. Complaints of muscle ache. Pinagpapawisan. Shaking. That's a withdrawal. Everything here is going up. Spouses stated that she noticed his spouse slurred speech that started 4 days ago. Slurred speech. Is that an intoxication or a withdrawal? If you're talking very slow, then you are intoxicated. Very good. No? Nakuha nyo na. You have already understood your substance abuse. So any questions so far? No questions so far? Okay. Sige. Let's have a 5 minute break para ma-marinate natin. So we can marinate all the information we just have recently learned. Okay. After 5 minutes, we will continue with dispensing and use of medication. Okay. Okay, let's continue. So ang next natin na topic is dispensing and use of medication. Okay, so ano yung mga different professions, who can give this, who can give that, who can. Okay, so for RNs, they can give all types of medication as long as it is prescribed. No, they can give all routes, parenteral, even specialized routes such as intraosseous or tawag yan, intraperitoneal, pwede ka RN. For LPNs, we just have to remember that LPNs cannot give anything in the blood vessel. So no IVs or central line. Bawal din sila. They can also give in specialized routes. Now, specialized routes such as your intraperitoneal. Okay? Yan. For UAPs, no, they cannot give medications at all. So no meds. Definitely no meds. They can give barrier creams as long as the cream is not medicated. If it's medicated, bawal. When it comes to enemas, they can perform enemas as long as it is not retention enema. Because retention enema is medicated. Okay? Sige, let's continue to your 10 rights of administration. Ayan. So, paulit-ulit. So, let's mix it up a bit. Let's only discuss the important things that we need to know when it comes to the 10 rights of administration. For the right medication, to determine that it is the right medication, always counter-check with the order of the doctor and the medication administration record. Yan, para malalaman natin if it is the right medication. For the right dose, no? For the right dose, you have to, wait, oh, sorry. For the right medication, then you have to check the label 3 times then. Check label 3 times. Yun. For the right dose, you have to confirm with the HCP, no? Confirm with your medication administration record, and you will have to be able to perform your dosage calculations. Okay? Okay, next, for the right patient. No, for the right patient, you need at least, no? So, sulat natin dyan, at least 2 patient identifiers. Okay. Sige. Give me patient identifiers. Examples of patient identifiers. Okay, ID band, pwede. But what are we looking for in the ID band? Okay, birthday, very good. That's a unique identifier. Name, yes. First name, last name, ano pa? Patient number, yes. Ano pa? Okay. Any other unique identifiers we have out there? Age, okay. Birthday siguro, but age, hindi na. Hindi na kasali yung age. Okay. You can also use the case number. For example, the patient is for surgery. And case number or hospital number. Aside from that, you can also use the social security number because social security numbers are only present for one person. No? So, hindi siya nagbabago-bago. Or the income tax return number, ITN. No? Income tax identification number, ITIN. Okay? So these are some of the unique identifiers that we can use when identifying the right patient. Just remember, you need at least 2. At least 2. If you can have more than 2, no, that's okay, but at least dalawa lang. Okay? Next, for the right time. So when giving it for the right time, it always falls under hospital policy or facility policy. No? Hospital policy. What do I mean by this? No? Each hospital would have a different BID, TID, QID. Iba-iba. No? Hindi siya, it's not the same in every hospital. They translate the twice a day, 3 times a day, 4 times a day, depending on their own research or their facility. So it always falls under hospital facility. For right route, there's nothing to remember there. Just remember it should be in the right route. For the right documentation, okay, so when do you document? When you give medication, do you document before? Do you document during? Kailan? You do have to document after giving the medication, right after, no? As soon as possible. Okay, for the right education, you have to teach the patient about the side effect, the adverse effect, and how we can manage this. Possible drug interactions. Okay, now what are the indications and contraindications when it comes to certain medication? Okay, next, the right to refuse. Okay, which ethical principle is being honored when a patient refuses? Very good. It's your autonomy. No? When a patient refuses, you are honoring the patient's autonomy. But what can we do if the patient indeed refuses? For example, told the patient, "Sir, I will give you your insulin." The patient says no. What would be your first response? Very good, no? You teach the patient, okay, "Sir, you need this insulin because I don't want you to die. And if you did die, I will have to stay in this hospital longer and I want to go home." Okay, and the patient says, "I still don't want to take it." Okay, you have already taught the patient and still he is refusing. So what would you do next? You, yes, you notify, no, the physician. So you tell the doctor, "Doc, the patient is refusing to take the medication." So the doctor goes to the patient, tells the patient, "Sir, you need to take this medication. I'm an intern and I don't like what I do. I'm tired and I want to go home as well." The patient says, "I don't care. I don't want to take the medication." So what would be the last step? Okay, very good. Documentation, and the patient has to sign a waiver. Ayun, no? Or an against medical advice, no, that, but usually that's for discharge, no, pero a waiver. So this would indicate that you have already taught the patient, you have notified the doctor, and the doctor has taught the patient, but the patient still refuses. So this is the step-by-step process. Okay. Next, right assignment. No? So when it comes to the right assignment, right assessment, no, there are certain medications that you need to assess for allergies, diba? You need to assess for fluid and electrolyte imbalances, metabolic panels, no? Okay? And lastly, right evaluation. So it's very important that after you have given the medication, you reevaluate. Ano po yung MAR? MAR is your medication administration record. Okay? Medication administration record. So, nakasulat dyan, no, it's written there all the medication that the patient needs for that day. So you have to counter check if it's in your medication administration record and the healthcare provider order. Okay? So these are the important things that we need to remember about your rights of administration. Sige, let's continue. Now, let's discuss about your medication administration and maybe, if we have time, computation. Now, when it comes to medication administration, no, I will uh, inform you this is a very boring topic. And usually, I would notice when I start discussing medication administration, no, my students just go away because they're tired listening to me. So I'll just tell you right away that it's boring and I can't make it fun. I'm sorry. So we'll try our best to get through this, and after that, it will be fun, I promise. Okay, so let's start with different routes of administration. First would be your oral administration. Okay, oral medications are the most convenient. Okay, because you can buy them anywhere. No, you don't need that much doctor's order, blah blah blah, and it is economical. No, ibig sabihin mura. No, it's not that expensive. What are our RN considerations when it comes to this medication? First is your scored tablets. So what are score tablets? These are score tablets. Ito yung mga tablets that has a score in it. Yan. Tatandaan nyo that only score tablets are the ones that should be divided into two. No? They are the only tablets that can be divided into two. Other tablets that are not scored cannot be divided into two. However, in actual practice, they still divide it, diba? In actual practice. But NCLEX, diba, it is the most ideal. Therefore, these are the only tablets that you can divide it. And when you divide, use your pill cutter. Do not use your nails. No? Huwag mong pahabain yung kuko mo and then sabihin mo, oh, pill cutter ko kasi ito siya. No? Don't you, teeth? Oh my God. Okay, you can use your teeth, but place a glove in your mouth. No? Just put a glove in your mouth and then para sterile. Okay, so again, pill cutter lang. No teeth, no hands. Okay, next. Enteric coated. So enteric coated tablets, mga extended release. No? These types of tablets or slow release tablets, so these tablets, our nursing consideration is we can never alter the form. No? Never alter the form. So we cannot crush this one, we cannot cut, we cannot pulverize, never alter the form. So question, what if the patient was prescribed omeprazole? Omeprazole is an enteric coated tablet. And the patient has an NGT. What would we do? No, naka-NGT si patient. What would you do? Okay. So, yes, now look for a different form. So the first thing that you would do is inform or notify the healthcare provider or the pharmacy. So they can provide you with a different form. Okay, because you should not alter the form. Next, capsules, powders, gel. No? So capsules, ito yung parang ganyan. And then you can separate it and there's stuff inside it. Diba? There is a powder. Okay? So capsules, powder or gel, tatandaan natin that we cannot remove the content. Do not remove content. Okay? And also don't add to food. So, do not remove the content and then itaktak mo sa tawag yan, NGT feeding ni patient. And then mix, 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 you can give it now to the patient. Okay? So that's wrong because when you remove it from its content, it loses its effect. So don't remove. Aside from that, for liquids, for liquids, so liquid preparation can be very bitter. Bitter. So best way to do that is to offer something cold. Something cold before. What would you offer that is something cold? Of course, you can tell the patient that you don't want him anymore. I don't like you anymore. So medyo malamig yun. Ugh. Okay? Wrong. That's not the cold I'm talking about. So the cold that I'm talking about here is you can offer popsicles, or cool drinks to numb the mouth para hindi niya matikman. Okay? Additionally, when it comes to liquid in general, don't add milk. No? Don't administer with milk. Okay? Because if you administer with milk, the medication will adhere to the protein of the milk. And when it does, nawawala yung effect. So don't administer with milk. Aside from that, in general din, mga antibiotics, in general to antibiotics na oral preparation, don't administer with juice. Administer with citrus juice, such as orange juice or lemon juice. Paano po yung sa baby? Oh, iba yung breast milk, The milk I'm talking about here is your, Nido. Nido fortified. Okay, para hindi tayo magkalituhan. The milk I'm talking about here is the one that is coming from the cow. Pero breast milk, okay lang yun because breast milk is natural. But there are medications that you give before, before breastfeeding, such as nystatin. You give it before you breastfeed, not after. Okay? But the milk I'm talking about here is yung formula. Formula milk. Okay, sige. Now, how do you administer medication syrup? Okay? When you administer medication syrup, so this is your medication syrup, first, open and remove cup of the medication bottle. Oh, hindi nyo alam yun, no? Ganun pala yung start. So the first thing that you would do is to remove the cup of the medication bottle. Okay. After removing the cup, no, place the medication cup on the flat surface. Okay. So this one is usually found here. Nakaganyan kasi yan siya. Most medication syrup are built in with their medication cup. So you remove this one, put it on a flat surface. After you have put it on a flat surface, pour the medication cup. After you have done that, wipe the lip of the bottle. The reason why you wipe, it's because syrups contain sugar. And when sugar, no, is exposed to air, it becomes hardened. So that's why you need to wipe it, or else it will be difficult to close. After that, you recap the bottle. No? So take a note of this one. It might come out. No? Yung arrange it in proper sequence. That's the proper sequence. Okay? So any question? Okay? No question? Okay, let's continue to other administration. Meron tayong buccal. Buccal is the side of our cheeks. So our nursing consideration there is to uh, alternate cheeks. Alternate the cheek. Yun lang. Okay? Nothing more. For sublingual naman, sublingual medications are the one placed under the tongue. Okay? Placed under the tongue. After that, what is our nursing consideration? Of course, we tell the patient not to swallow because when they swallow, the medication loses its effect. The reason why we place it under the tongue because under the tongue contains a lot of capillaries, no? So easier absorption. For isordil, no? Isordil is a nitroglycerin, no? Or nitroglycerin containing medication. Our nursing intervention there is that we tell the patient to monitor or observe for burning or stinging sensation under their tongue. This burning or stinging sensation means that the medication is working. Gumagana pa. Next, for isordil, the best position is to lie supine. Okay? Because most sublingual medications are vasodilating. So if you give them, no, their blood pressure goes down significantly, so they might start to feel dizzy. So higa sila. Of course, gradual change of position because they might have orthostatic hypotension. Okay, and also avoid warm bath because warm bath causes the blood pressure to further go down. Mas bababa pa siya. Okay? Next natin. Now, this one is quite a long one. Inhalation medication. No? For example, your albuterol inhalers. Okay? I will not go through all of this. No? I will leave it into your into your responsibility to read the step-by-step process on how to use an inhalation albuterol. What I will do is focus on specific factors lang, specific things. Okay. So, first na gagawin is hand hygiene, of course. Next is perform the rites of medication. Yes, that's common. Now, a common problem here is if the doctor prescribes more than one puff. No? Sabi ni doc, 2 puffs. So, if there is one, more than one puff, how many minutes or seconds do you space the puff? Okay, you space the puff for 1 minute. Very good. 1 minute lang. Okay? What if the doctor said you need to give bronchodilator and corticosteroid? Which would you give first? Bronchodilator or corticosteroid? Dilator first. Okay, so bronchodilator first, and then space it with 5 minutes in between, and then corticosteroid later. No? So if there is more than one inhalation medication, for example, corticosteroid, bronchodilator, or anticholinergic and bronchodilator, the space between medication is 5 minutes. But if you're being asked what is the space between puffs, it's 1 minute. Okay, 1 minute. Next, priming the inhaler. So when you prime the inhaler, no, the reason why we prime the inhaler are the following. No? First, it's brand new. No, brand new. We have recently bought it, so you prime it. Second, no, not used for 1 week. Okay, it's not been used for 1 week. And third, recently dropped. Okay, so how do you prime? To prime the inhaler, shake the inhaler, and then spray away from your face 3 times. Okay, so priming is to spray away from your face 3 times. And once the inhaler is primed, you can now use the inhaler. So steps 4, 5, 6 pababa is how to correctly use the inhaler. So first, hold inhaler between your thumb. Okay, if you need a spacer, then connect it to a spacer. So the reason why a spacer is needed, because spacer allows the medication to last longer. No? It allows the medication to last longer. Now, after that, no, after you have used the inhaler properly, okay, you have puffed and held your breath, no, for 10 to 12 seconds. You now have to gargle and rinse. Very important. You gargle and rinse because this can dry the mouth, and a dry mouth is a bed. No, it's an agar for infection. Okay, so gargle and rinse the mouth after, because we don't want any candidiasis or moniliasis that develop. Candidiasis, or also known as your oral thrush, is an infection usually associated with the use of corticosteroid inhaler. Now, it looks like white patches in your mouth, no? Little white patches. The drug of choice for candidiasis and moniliasis would be nystatin. No? Nystatin, pero nystatin here is not in tablet form, it is liquid form. Okay. When administering nystatin, it would depend if the patient is adult or pedia. If the patient is adult or infant, sorry. If the patient is an adult, no, you tell the patient to swish and swallow. So, mumog, lunok. Mumog, lunok. If the patient is an infant, okay, so this one is given um, this one is given after breastfeeding, no? After breastfeeding, and you swab it. So you just swab it on the area. Okay. So after the patient has breastfeed, then you swab the nystatin, and then that's how it's administered. Okay. So again, swish and swallow for adult, for infant, swab. Okay. After feeding. Okay. So next, now this one is how to use it without a spacer. It's the same thing. You shake the inhaler 10 to 15 seconds. Okay? Position yourself upright. Breathe deeply. Put it inside your mouth. Administer during inhalation. So when you press, you inhale. Sabay siya. Press, then inhale. Okay, simultaneous. Hold the breath for 10 seconds. Repeat with an interval dose of 1 minute. And last, rinse the mouth. We rinse the mouth because we don't want to acquire what condition again? Rinse the mouth because we don't want to acquire oral thrush, no? Candidiasis or moniliasis, correct. And if we indeed acquire candidiasis or moniliasis, what would be the drug of choice? Very good. It's your nystatin. And nystatin, when administering in adults, what do we tell the adult? To swish and swallow. So, mumog, lunok. Very good. Okay. Sige, next. Topical na tayo. Okay. Topical medications. Okay, topical medications. So, our RN consideration when giving topical medication, it should be on the palm of a gloved hand. Of course, you have to clean your hand first. Palm of a gloved hand. Next, use even strokes and follow the direction of the hair. If you are against the hair, it's not going to stick in the skin. It's not going to stick in the skin. Now, what about medicated patches? Okay, so listen carefully because medicated patches can differ between the type of medication. Okay, in general, you have to remove the old patch. After you remove the old patch, you dispose it properly. Dispose it by closing it into itself, like closing a book. No? Folding the medicated sides together, so into itself. Next, choose a clean and new site. Okay, listen. So, for nitroglycerin patches, the site should be proximal to chest, near the chest. The site should be flat, clean, dry, and non-hairy. Okay, non-hairy. That's for your nitroglycerin patch. For opioid patches, the site does not need to be proximal or near the area that causes pain. For example, if you have bicep pain or pain in your arm, you don't need to put it near the arm. As long as the site is flat, clean, dry, and non-hairy, you can place it there. Okay? You can place it there. Next. So, you can after that you put the time, date, and initial outside the patch and remove the outer covering. No? When you put the patch, you hold it at the very edge, no, to prevent the risk of absorbing the medications. Kasi when you hold the patch, you might absorb it. So, no, don't hold the patch. No? And apply the patch to the desired area. Press firmly for 10 seconds. No? Once it's there, don't rub. No, don't rub because rubbing it increases absorption. So just hold it, no, to the area. Yan. For nitroglycerin again, no? For nitroglycerin patches, you have to remove the patch every 10 to 12 hours to prevent tolerance. And also you have to rotate it. No? You have to rotate. Even with gloves, yes, even with gloves, hold the very edge. Don't hold the middle. No? Because as much as possible, we don't want to be affected by the medication. So the very edge talaga. And then we press firmly. Okay. So as I've mentioned earlier, we need to find a flat, clean, dry, and non-hairy surface. What if the surface is very hairy? What would you do? What if the surface is extra hairy? You, okay, shave. Pero what would you need? What type of shave? Razor shave? Ano? Electric shaver. Very good. Or electric clipper. So don't use any razor shave. Use an electric shave or an electric clipper. So to prevent any wounds, because if there is an open wound and you administer medication there, no, yung patch, mas mabilis ang absorption. No? It has a faster absorption. Okay? Okay, sige, next. Ngayon, sa mata naman, no? So, RN consideration when it comes to eye drops. First, you tell the patient to look at the ceiling, no? And then, you retract the lower eyelid, exposing the palpebral conjunctiva. Okay. The palpebral conjunctiva acts as a pocket. No? So when you administer the medication, it will not drip immediately. It will just go to the pocket, the palpebral conjunctiva. Next, stabilize with your dominant hand in the client's forehead and administer the dose. No? Tulo mo na. Administer the dose, no, by squeezing it. After that, no, instruct the client to close his eyes, usually for 20 to 30 seconds. And while the patient closes his eyes, you tell the patient to occlude the nasolacrimal duct. Why should you occlude the nasolacrimal duct or the tear duct? No? Ganyan. Occlude the nasolacrimal duct. We tell the patient to do that to prevent systemic absorption. No? Prevent systemic absorption. So it is only localized to the eye. Okay, ganyan. Next, for the eye ointment. So again, with clean hands, with clean gloved hands, okay? What you would do first is discard the first bead because the first bead is considered, no, dirty. It's like drinking whiskey, di ba? Or tanway. You discard the first drop because it's dirty. Okay? So discard the first bead. After you have discarded the first bead, ganon pa rin. You tell the patient to look at the ceiling, expose the palpebral conjunctiva, okay? Apply a ribbon from the inner to outer canthus. After that, close the eyes gently, do not flush the eye, and then allow it to be closed for at least 20 to 30 seconds again. 20 to 30 seconds. Okay? And then for 20 to 30 seconds, tell the patient not to drive. Kasi, their eyes might be irritated, baka mabangga sila. Additionally, it is best given at night, but this is usually for safety reasons. Because if you gave a medication that affects your sight, then mas mataas yung risk mo mabangga. But of course, you can give it in the morning naman, as long as the patient is safe. Okay? So very simple, no need to elaborate. Okay, next, ears na naman tayo. No? How do we administer to your ears or otic medications? First, we have to warm the medication, room temp. Why do you think it's needed to warm medications that is placed in your ear? What's the reason? Why do you need warm medication? Because if the medication is cold, it will cause vertigo. Very good vertigo. No? So, warm medication to prevent any dizziness or vertigo. Yan. Next, you straighten the ear canal. And I know you already know this. No, you already know this. If your patient is less than 3 years old, no, how do you pull the pinna? Yon, back and down. Very good. Patient is 4 years old and greater. How do you pull the pinna? Up and back and up. Oh, very good. Back and up. So you straighten the ear canal. Then, no, when you are going to give a drop, you need to be at least 1 centimeter from the ear canal. From the ear canal. Now, 1 centimeter from the ear canal. Do not directly aim at the tympanic membrane because it may lead perforations. Pwedeng mabutas. Instead, administer on the canal of the ear. Now, just let it drip down. And once it is there, we tell the patient to hold position for at least 1 minute. 1 minute para ma-absorb yung gamot. Very simple. Next, nasal spray or intranasal medication. No, position the head neutral. Do not aim for the bridge, which is a common problem. Ito yung ginagawa nila. No? They aim directly on the bridge of the nose. It's wrong. No? Instead, neutral position, aim straight up. Pataas lang. Okay? After that, if there is any secretions, no, kasi tutulo yung sipon, encouraged to blow the nose gently. Avoid any hyperextension because if you give intranasal medication and the patient is hyperextended, it will go to the back of the throat. So hindi siya mapupunta sa area where you need it to be. So maintain the head neutral. Neutral lang. Okay. Next. I hope you're still alive and following. Next tayo, rectum. No? How do you administer rectal medications or suppositories? Okay, first, we have to know the contraindication. So, who are the following patients that are contraindicated to rectal medications? O, sino? Okay, so if you have any question ha, just ask your questions sa ating chat. Ano yung mga answer? Yun. We have your ano yan, heart conditions. Very good. No? Mga heart condition. Ano pa? And sabi dyan, bleeding. Okay, bleeding problems. Yes. Rectal surgery or rectal conditions, of course, because you might damage the area. Okay, ano pa? Heart conditions, bleeding, and mga patients who are ano, immunosuppressed. Yan, that's what I was looking for. Immunosuppressed. No? Because we might introduce bacteria in a highly vascular area, which is your anus and rectum. So, determine the contraindications, mga heart conditions, bleeding, immunosuppressants. If they are not contraindicated, then we can administer. So, suppositories, do not freeze them. Refrigerate, but do not freeze. If you freeze them, no, below ano ba 0 degrees, usually nakikita natin sa ref, and you put that inside the rectum, it will take very long for that to melt or to thaw out. So it's just gonna be like parang a very cold feces in your butt. No, it's just parang may malamig na tubol na naiwan doon. So do not freeze. Next, prior giving, lubricate. No? And this is a general rule when it comes to nursing. Before ipasok, lubricate. Okay? Well, I guess that's the general rule with life. Before mo ipasok, lubricate mo muna. Okay? So, lubricate before application. Now, you have to position the patient. Of course, what would be the best position pag ipapasok mo? Oh, baka iba-iba na yung mga iniisip nyo. Anong best position bago ipasok? Up. Focus. We are still nursing. Nursing topics pa rin. No? Baka iba na yung mga iniisip. What is the best position before ipasok? Left. Left. Side lying. Okay, kompletuhin nyo. Left side lying. Okay. Very good. Left side lying. Or, tinatawag natin left seams position. Okay. That would be the best position before you insert your suppository. What is the reason? Why would be that why it would be the best position before ipasok ang suppository? It straightens the, yes, very good. No? It straightens the anus, the rectum, and the sigmoid colon. So, mabilis siya. It's easier to insert. Okay, so position left side lying or left seams. Next, insert the suppository, no, and then press the buttocks together after inserting. So it would prevent it from going back out. Instruct the patient to remain supine or side lying for it to become absorbed. And once it is absorbed and the patient needs to defecate, then the patient can defecate. But remember, tell the patient not to flush before, now not to flush after the defecation, because it is your nursing consideration to immediately monitor, no, what came out. Is there blood? No? Is it clear or is there something wrong? So you have to monitor. Okay? So don't flush so you can monitor feces. No? If there is blood, is it clear, etc. Okay, next. No? Sa vagina. Okay. So when you're giving suppositories with vagina, no? So this is um, easy because it has applicators, no? This is what you call your applicator. You can put the medication on the applicator and then insert the applicator, and like an injection, it has a plunger. It will just push the medication out. So no need to push it with your finger. No? Just remember to clean your hands, lubricate applicator, and administer medication. Yes, lubricate. O, naalala ni Maria. Very good, Maria, for remembering uh, life teachings. Okay? So we are done with the different administration routes. Any questions? Any questions with all the routes? No? Overloading ba? Hmm. Para sa akin, oo. No? There is a lot of positioning and insertion. Okay? So nakakapagod siya isipin. So are there any questions? No questions? Okay. So before we start, because we are not done yet, we still have your parenteral routes. Oh my God, more routes. So before we discuss more insertions, let's have a 5-minute break so we can think of all the insertions we've done in our life. Okay? So let's have a 5-minute break and we will continue with parenteral routes. Okay, so I'll see you back after 5 minutes. Okay, let's discuss parenteral routes. Okay, sige, let's make it simple lang, no? Para hindi tayo ma-overload. But I guess overloading na talaga yung information kanina pa. So, we have different parenteral routes. We have your ID, IM, and sub-Q. IV will be discussed later. For intradermal, no, our site would be the dermis, lower ventral surface of the forearm or scapula. So, dito, di ba? Okay. If you could still remember, what are the reasons why we perform intradermal pag nag-intradermal tayo? Give me the most common reason. Skin testing. Yes, no? Especially when we want when you are looking for allergic reactions, no? Prior surgery, ganyan. PPD, no? When you are testing for tuberculosis. Yes, that is the most common, no? So PBD and determining for allergies. Our equipment, 26 to 27 gauge, the amount is less than 0.7 L, and the angle 10 to 15 degrees. Okay. Now for the deltoid, for the IM. For the IM, we have different sites. And each site, we have to remember that meron siyang landmark. For your deltoid, the landmark is your acromion process, no? The bony protrusion found in our shoulders. Acromion process. Okay. Next, your vastus lateralis, it is the outer third, no, the outer middle third of your thigh. Okay, just take note kung ano yung mga landmarks. For rectus femoris, it is the middle of the thigh. Okay, for dorsogluteal, it's the posterior, okay, superior, iliac spine. Okay, so medyo mahaba. Posterior, superior, iliac spine. And for your ventrogluteal, no? This one, mahaba talaga to. Your index finger should be placed in your anterior, superior, iliac spine, your ACs. Your middle finger should be placed in your iliac crest. Later, we have an image para mabilis intindihin. And lastly, your palm should be at the greater trochanter. Palm should be at the greater trochanter. So that is our different landmarks. Okay, don't worry, we have images for this one. Now the equipment, 20 to 23 gauge or 1 to 3 inches na syringe. Best way to remember, look at IM. I, no? I looks like what number? I looks like number 1, di ba? I looks like number 1. So, when it is being asked, what equipment would you use if you're going to give IM? Look for 21 gauge or 1 inch needle. 21 gauge or 1 inch needle. Okay? Now, the amount, it can't be greater than 3 ml kasi 3 ml is the starting syringe for IM medication. No? So 3 ml is the starting syringe for IM medication. We don't have any 2 ml IM syringe, no, or 1 ml IM syringe. 3 ml ang start. For vesicant solution, we have to perform your Z-track technique. Okay, so to perform the Z-track technique, and you might need to take note because this might come out in your put it in proper sequence question. First is you displace the skin. After you displace the skin, inject with the dominant hand, stabilize with the non-dominant hand, wait for 10 seconds, remove the needle, release the skin. This is the step-by-step process on how to perform the Z-track technique. Okay, next, your sub-Q. For subcutaneous injection, you have to inject it in your taba, sa taba, in your subcutaneous. But this is an acronym nyo. You have to inject it in your thigh, in your abdomen, okay, in your buttocks, or in your upper outer arm, no? Taba. Okay? The equipment, 23 to 25 gauge or 0.5 inches. Best way to remember, sub-Q. Look at letter S. What number does it remind you of? No? It looks like number 5. Very good. So 25 gauge or 0.5 inches. That's the best way to remember it when there is a question asking. Okay? The angle is 45 degrees or 90 degrees. It would depend. 90 degrees are commonly used for obese patient, for obese. No? 45 degrees are for normal weight or lean patients. Okay. So, next slide tayo. These are the images. Ayan. So, as you can see, for deltoid, look for the acromion process. For your ventrogluteal, your index finger should be in the iliac crest. Your middle finger, your index finger should be in the anterior superior iliac spine. Your middle finger in the iliac crest, and your palm in the greater trochanter. And you inject on the middle of that. Okay. So yan. So these are just some of the landmarks. Okay, so with this one, this is how Z-crack technique works. Diba? You displace the skin with your non-dominant, you inject with your dominant, no? And as you remove, the vesicant medication cannot leak and burn subcutaneous tissue. So, nandito lang siya. Okay? Next, this would be the different areas if you want to inject on your subcutaneous, diba? Inject on your taba. No, we have your thigh, abdomen, upper outer arm, no? And your buttocks, your lower loins. Okay, next, for your intravenous therapy, your IV therapy. So for IV medications, again, can LPNs give IV medications? Yes or no? No. Who can only give IV medications? RN. Tatandaan ha, only the RN can give medications that involve the blood vessel. Okay, so for IV medication, the site is the vein. The onset, rapid. Okay, principle, distal to proximal. So we will have to start furthest before we go up, no? Before tayo tataas or near the body. Furthest to nearest. We avoid areas of flexion where there is joint because kung doon tayo tutusok, easily dislodged. Measures to distend the vein. So how can we make the vein bulge? Okay, these are the following things that we can do. Position dependent, no, or lower than the heart. We can also perform vein tapping, but take note, if you are infusing something vesicant, maybe avoid vein tapping, no, kapag vesicant yung ibibigay mo. Kung hindi naman vesicant, if it is not vesicant, you can perform vein tapping. Next, creating a fist, no, and warm compressions. But the most common, I think we all do, would be your tourniquet test, no? Or you put a tourniquet 6 inches distal to where you will occlude and you allow the vein to bulge. Okay, so these are just some measures that we can perform to distend the vein. Contraindications to IV therapy. First, AV fistula. If that area has an AV fistula, immediately that area is IV precaution. Okay? Because we might damage the fistula, and once it is damaged, it can no longer be used. Next, breast surgery. Patients that has undergone mastectomy, no? Radical mastectomy ba yan or simple mastectomy? Again, you cannot infuse in that area. For example, they had a right mastectomy. You cannot infuse on the right arm anymore because it might cause lymph edema. Lymph edema, so delikado. If the area is infected, of course, no, you might introduce infection into bloodstream. If the area is swollen or paralyzed. So these are some contraindications to IV. Now, when you're performing your IV, we have to remember that it is a sterile technique. Okay? Sterile technique. To determine that you are inside, no, there should be a backflow before you infuse, no, before you infuse. So you would know that you're inside the line if when you, when you um, cannulate, there is a backflow. You're already inside the line. But if there is backflow during or even after infusion, that is not good. Dangerous na yan siya. Backflow should only be seen before infusion. Okay? So, in the US, a general practice nurse can have only 2 attempts. 2 attempts. After 2 attempts, and they failed, they have to delegate it to the IVT nurse or the doctor. Okay? For pediatric and neonate patients, general practice nurses or any nurse for that matter cannot perform IV cannulation. It can only be performed by our physicians. Okay, so for pedia and neonates, only physicians can perform cannulation. Okay? Okay. How many attempts can the nurse attempt to perform IV cannulation? 2. Your nurse is a neonatal ICU nurse. Can that nurse perform intravenous cannulation to a pedia? No. Who can only perform IV cannulation to pedias and neonates? Only your doctors. Okay, very good. Okay, next, mga types of solutions. Okay? Types of solutions. So first natin na solution, isotonic. We call it isotonic isosame because it has the same tonicity, no, in our blood. Same tonicity. So there is no change in intracellular size. No? Same tonicity lang sila. Examples under isotonic would be your normal saline, your LR, and your D5 water. Indications for this one is patient is dehydrated, burns, blood transfusion, but you have to remember when you're performing blood transfusion, there is only one solution that you can give. And what is that solution? It's your NSS and nothing more. Okay? NSS lang. Okay. So it is contraindicated for hypervolemia because it can further increase fluid volume retention. Next, your hypotonic. We call it hypoxpand because the fluid, the solution has low solute concentration. No? It has low solute concentration, which means the water will go inside of the cell, causing the cell to expand. That's why hypoxpand. The cells expand. Okay? So, anything less than 0.9 NSS is considered hypotonic because it has low solute concentration. It has low sodium and chloride concentration. Main function is that it replaces cellular fluid, establishes renal blood flow, I function, no? And for hyper, sodium chloride. So if you have too much sodium, if you have too much chloride, you can give this one to dilute the amount of sodium. Contraindicated if you have intracellular edema because this solutions increases cell water inside the cell or cell edema. Next would be your hypertonic solutions. Hypershrink. Hypershrink because it causes the cell to shrink. This solution have higher concentration, thus it moves the solutes from the cell towards the solution, causing the cell to start to shrink. Okay, so indication, fluid replacement, nutrition, which is common, ito yung pinaka-common yung na reason, and it mimics electrolyte concentration. Contraindication niya, kidney problem. And last, when it comes to solutions, would be your colloids. Your colloidal solution, pinaka-best example natin would be your human albumin. Okay? So, the main effect of colloids or Now, your human albumin is that it pulls in water inside your cells. So, for example, this is your blood vessel, and you give colloids. So, yan. So, if you have a lot of colloids in your cell, you have lots of human albumin, it pulls water inside it. Okay na? Next slide na tayo. Okay. So again, it pulls water inside it, no? And it retains that water inside the blood vessel. So that's why it's a plasma volume expander. So it expands the volume inside your blood vessel. So indication niya is shock, because when you have shock, all the fluids are leaking out, di ba? You don't want that fluids going anywhere. You want it inside the blood vessel. Liver cirrhosis. Pag meron kang liver cirrhosis, you have problems with producing protein, your albumin. Without albumin, nag-iedema. So it prevents edema. Burns, no, to prevent third spacing. And also malignancies, no, cancer. Any in general, no, cancers decreases protein. So tandaan nyo yan, ha. Cancer decreases protein inside your body. The reason for that, it's because all the protein that is needed to make new cells, that is needed to repair cells, is being placed into cancer cells to make that cancer cell bigger, no, more dangerous. So, cancer patients needs human albumin or mga plasma volume expander because of decreased protein. Okay. Contraindications are renal problems, di ba? If you have a renal insufficiency, you cannot urinate excess water. If you give human albumin, the body retains too much water. So you don't want that excess water. You want it removed. Next, pulmoedema and congestive heart failure. Again, same problem. They are retaining too much water. Give human albumin, no, they will retain more of it. So that's dangerous. No? So mali siya. Okay? So next slide tayo. 1, 2, 3. Yan. So these are your different IV cannulas. Each cannula can be used for specific things. Okay, so larger cannulas are, the larger the cannula, the lower the gauge. Okay, larger cannula, lower gauge. So 14, 16, these are really big cannulas. No, 18, malaki na din yan. The higher the gauge, the smaller the IV, no, the IV cannula. So, ito na yung mga different examples niya and the reason why we use it for. No, you can just refer to this one na nakasulat naman dyan. Okay? So, any questions with parenteral administration? Any questions with parenteral administration? No questions. Okay? Let's talk about the complications of IV therapy. No, mga adverse effect kapag nag-IV therapy tayo. So first complication natin is air embolism. This occurs when there is air stuck in the tube and it is administered towards the patient's blood vessel. Now, usually air, no, the gas bubble, it is reabsorbed. No, nare-reabsorb lang yan. But if it is big enough, it can cause an embolus, no, like this one. It can cause an embolus. It can cause a stroke. So, the manifestation of air embolism is a sudden onset of chest pain. Sudden onset chest pain. Other signs and symptoms are restlessness, difficulty of breathing, petechiae, which is common with any form of embolism, no? Air ba yan or fat? Petechiae is a sign of capillary rupture. Hemoptysis, okay, low-grade fever and severe anxiety. What is our management? Stop the IV or clamp it as fast as possible. Position the patient, Durant's maneuver. What is Durant's maneuver? What position is that? That is your left Trendelenburg. Very good. That's your left Trendelenburg. So this position slows down the travel of the bubble towards the lungs. So because it is slow, it might be reabsorbed lang. But remember ha, kapag air embolism, the position is left Trendelenburg. Kapag fat embolism, what is the position? Fowlers. No, high Fowlers. Okay? Air embolism, left Trendelenburg. Fat embolism, high Fowlers. Okay. After that, oxygen, notify physician because, di ba, dapat lahat ng complication, the physician should be notified. For the pain, pwede siyang bigyan ng morphine. Well, morphine is already given kapag nagko-complicate na siya, when there is already a complication. And lastly, BLS or ACLS when it has complicated into pulmoembolism or an MI. Okay, so this is your step-by-step procedure with air embolism. Okay, next tayo. Infiltration. Okay, now in infiltration, IV cannula becomes dislodged. The difference between your infiltration and your extravasation is that in extravasation, the IV cannula is dislodged and the what was being administered is vesicant. So it is already leaking and burning the area. Now, in infiltration, it is a non-vesicant solution. Okay? Na natanggal sa line. So, what are the signs and symptoms? You would notice that there is swelling because there is edema or fluid formation. It will be cool and shiny because the fluid is cold. Correct, no? Chemotherapeutic drugs causes extravasation. But there are other medications that can cause extravasation that are non-chemotherapeutic, okay, such as dopamine. Dopamine. Okay, next. Pallor, it becomes pale and you would notice that there is leaking fluid. Ayan. So, what should we do? Again, stop the IV, position the patient by elevating to decrease swelling, check the pulse and the capillary refill time of the distal site. So, para malaman natin is affected na siya. You can also use alternate, wait, hindi pala. And then you notify the physician. Okay? Because, again, this is a, tawag yan, complication. Sir, question from the previous slide, what is the rationale for fat embolism? Okay, so ito si patient, naka-high Fowler siya. Fat embolism, what is the most common cause of fat embolism? Okay, fracture, pero specific tayo, long bone fracture, no? Long bone fracture, what is the longest bone in your body? And don't you dare say your no, the longest bone in your body is your femur. So, pag nabali si femur, you put the patient high Fowlers because once it has reached your waist, will the fat embolism travel slowly? Mas mabagal ba ang travel ni fat embolism? Yes, mabagal na siya. So, it will not reach the heart or the lungs immediately. No? So, that's the reason why you position them like that to decrease the travel of fat embolism towards the heart and lungs or the brain sa mga central organs. Okay? So, that's for your infiltration. Okay. So, what would we do if it was an extravasation? So, ganon pa rin. You stop the IV, position, no, elevate to prevent any further swelling. No, check the capillary refill time, but most importantly, check for the tawag yan, skin tissue integrity if it has burnt, no, nasunog na. Okay, next. Sorry. Next, your phlebitis and pyrogenic infection. Okay, how would you differentiate the two? Phlebitis is localized. Pyrogenic infection, no, is phlebitis but the patient now has fever, no? Ibig sabihin systemic na siya. The the simple phlebitis has now spread towards the entire body of the patient. Okay. So the most common cause of phlebitis or pyrogenic infection is contamination, no? So improper sterile technique, or the cannula has not been changed for a very long time, or the tubings, no, has started deteriorating, the tawag yan, the IV has now started deteriorating, ganyan. So contamination. So what are the signs and symptoms? Well, for phlebitis, there is redness, diba? There is pain, there is swelling. Okay? So redness, pain, swelling, and you can't move it. So meron kang rubor, calor, dolor, no, signs and symptoms of swelling. Okay? Now, kapag pyrogenic infection yan, you would know it's a pyrogenic infection because you have a phlebitis plus a drainage. No? There is drainage in the area. There is purulent, foul odor drainage. The symptoms have now become systemic. The patient has fever, fatigue, confusion, and anorexia. These two commonly seen in elderly patients. Yan. So, phlebitis is localized swelling, pyrogenic infection, affected na ang system mo. Okay? So, your management, stop the IV. No? As much as possible, stop the IV. Wound culture and sensitivity, this one is done for pyrogenic infection. If there is pus formation, then you can perform this one. But if it is just a localized swelling, no need for culture and sensitivity. You can treat the swelling. Next, keep IV for CS. Again, this one would be for your pyrogenic infection. Notify HCP and administer antibiotics. Additionally, no, after you have removed the cannula, you can administer cold compress, no, for the first 24 hours and warm compress after the 24 hours. Now, cold first and then warm later. Okay, cold first, warm later. When it comes to extravasation, no, it depends because if the wound, if the skin has started sloughing, no, open na yung wound niya, you don't need to put cold or warm compress. You need to clean the wound, no, treat it like an open wound. But if early stages pa, no, early stages of extravasation looks like phlebitis, so it can be use cold compress for the first 24 hours. Once swelling has subsided, warm compress later, no, after 24 hours. Okay? So to prevent this one, you have to maintain your proper aseptic techniques. No? Maintain your proper aseptic technique. So change the IV solution. The IV solution should be changed every 24 hours or according to hospital policy. No? So different facilities will tell us when things needs to be changed. Next, number 3, IV tubing and IV site. So you have to change it. It is usually changed every 72 to 96 hours. The gauze. The gauze can be changed every 2 hours or as necessary. If the gauze is already dirty, you notice there is something in the gauze, you have to change it. Change the transparent dressing, yung Tagaderm. That one can be changed every 5 to 7 days or as necessary. If it is already dirty, then you have to remove it. No need to keep it pa. Okay? Any questions? Any questions so far? No questions. Okay, sige, let's continue to fluid overload. So, fluid overload, there is rapid IV infusion. There's too much. Aside from having a rapid IV infusion, the patient might also be increasing OFI. So, what are the signs and symptoms? You would notice that everything is going up. Lahat tumataas, no? Usually, the signs and symptoms are also similar to your congestive heart failure. Same lang sila. No? You would notice that the patient starts to develop hypertension, weight gain, ano pa, jugular vein distension, no? Pink frothy sputum, difficulty of breathing, ganun. It's the same as your congestive heart failure kasi congestive heart failure is retaining too much water pa rin. So what would we do? We either slow down the IV or stop the IV. So either sa dalawa lang yan. Slow down or stop. Okay, slow down or stop the IV. You slow down the IV if nasa early stages pa siya. If the patient says, I feel cold, maybe there is just too much water, slow it down. But if the patient is no longer breathing properly, tulad nito, no, is cannot breathe properly, you stop it, no, because we don't want to further the problem. Next, you position the patient high Fowlers, no, high Fowlers to increase expansion of lungs through breathing. You notify, no, you administer oxygen and then notify the physician. Now, if the patient, no, needs to remove all that excess water, they might be given diuretics, usually furosemide. Okay? And because they are under furosemide, insert Foley catheter na yan and monitor UO. Okay? But the furosemide part, usually last case scenario na to, when there is too much fluid being retained na. No? Additionally, for all of these types of emergency, tatandaan natin, we have to monitor the vital signs every 15 to 30 minutes kapag emergency. Tulad nito, like your fluid overload is considered a medical emergency. Air embolism, another medical emergency. So, monitor 15 to 30 minutes. Any questions to the complications of IV therapy? Any questions? Okay, no questions. Sige, let's answer the following. The client rings the bell and complains of pain at the site. On assessment, the nurse noticed that the infusion has slowed. Infusion pump shows downstream occlusion alarm. Assessing the infusion site, the site is swollen, reddened, and warm to touch. No other things noted. Complete the diagram by dragging from the choices below one condition, two actions the nurse would take, and two parameters the nurse would monitor. So what possible condition is the client experiencing? Is it phlebitis, fluid overload, extravasation, or infiltration? The answer is phlebitis. No? Phlebitis. It can't be fluid overload because fluid overload is manifested by parang congestive heart failure. It can't be extravasation because it was not indicated if the infusion being given was vesicant or if there is blistering or sloughing of the skin. And it is not infiltration because it is warm to touch. Infiltration is cold to touch. Okay, so what would be your nursing action? We need to find two nursing actions. We have to stop the infusion and then we have to remove the catheter. Okay, stop the infusion and remove the catheter. Why wouldn't we be performing letter E? Now, why is letter E wrong? Keep IV set for culture and sensitivity. We should be doing this one if if the patient has pyrogenic infection. And As we know, pyrogenic infection is manifested if the patient has systemic fever, confusion, anorexia, or if there is already pus formation in the site. So, wala tayong pyrogenic infection. So, letter D is also wrong because same vein. Of course, we will not start in the same vein. No, tanggalin mo na yan. So, what would be our monitoring? What would we monitor to evaluate the patient's condition? Answer is site and pain assessment should be enough and complete vital signs. Should we need to monitor the skin tissue integrity? When will we monitor skin tissue integrity? If the skin has now sloughed, for extravasation. This one is just a localized inflammation, so complete vital signs and site and pain assessment would be enough. Okay? Sige, let's continue. An 18-year-old client admitted to the ED for heat stress and acute dehydration after participating on a soccer game. After assessment, client is lightheaded, fatigue, and lethargy. Lightheaded, fatigue, and lethargic. With dry lips and mouth. Client is complaining of headache and muscle cramps 6 out of 10 pain scale. Temperature is 38, RR 22, pulse rate 100, BP 120/90. Encouraged to increase OFI and started with IV hydration, plain NSS 167 ml per minute to run for 6 hours. Okay? Client's mother observed to be encouraging the client to drink ORS. Client is observed to have energy and is active. IV patent and infusing well. Client states feeling nauseated from drinking too much water and ORS. Client refused to drink ORS. Client started complaining of shortness of breath, feeling cold, and nausea. For each body system, select the nursing intervention that would be appropriate for the body system. Each body system may support more than one answer. Okay, so before we answer, what possible condition do you think the client is experiencing? Client is experiencing fluid overload. Okay. Sige. So number 1, stop infusion. Is this an appropriate intervention? Yes. Okay. Where would you put number 1? In your respiratory, cardio, or renal? Why do we stop the infusion? We stop the infusion to prevent difficulty of breathing, di ba? So, lagyan natin sa number 1. No? Stop the infusion immediately so the patient does not further, does not have pulmonary edema. Okay, next. Place the client in left lateral decubitus. Is this the correct answer? Answer is no. No? Mali yung position niya. Administer oxygen as prescribed. Is this an appropriate intervention? Yes. Again, we put it in your respiratory. Slow down the rate of IV infusion after checking line for air. Is this appropriate intervention? No. Insert Foley catheter as indicated. Would we be inserting Foley catheter? What do you think in this patient? No? Is it warranted to insert Foley catheter now? No? This one is very good. Hindi pa pwede. No, you don't have any diuretics yet. It is not part in our case study din. So kung nakasulat sa case study, patient was given diuretics. Okay, so no diuretics, no catheter muna tayo. Okay. Strict intake and output monitoring. What about this one? Yan, okay. Yan, ito pa pwede, no? This one we can do. Okay, put it on your renal. Collect urine for urinalysis. Urinalysis, hindi kailangan. Urinalysis is for infection. Position the client supine with head of bed elevated. Okay. Naloko lang kayo konti, no? Position the client supine with head of bed elevated. Anong ibig sabihin ng position na yan? Supine with head of bed elevated. Ay, Fowler's lang man pala yan. Okay, so is that the proper position? Yes, that's the proper position, no? For lung expansion, you put it under number ay on your respiratory. Okay? So, supine, bawal. Pero sabi, supine with head of bed elevated. So, Fowler's. Monitor for symptoms of hypertension. Yes, because hypertension is a problem. So, we put it in your what system? Cardiovascular. Okay? The next, assess for flattened neck veins. No, because if you have fluid overload, what happens to our neck veins? Yes, no, distended, jugular vein distension, hindi na flattened. Okay, very good. Okay, ang next natin would be your central venous catheters and peripheral central catheters. Okay, so central venous catheters, take note, you should be in the hospital setting only. No, hospital lang siya. So, very important to remember this because you might encounter questions. You might encounter questions where it will ask you, which of the following patients can you discharge? Okay? A patient with a central venous catheter cannot be discharged kasi dapat nasa hospital lang sila. Okay? The site. The common site of your central venous catheter would be subclavian, intrajugular, and femoral. But femoral, no, they use this one cautiously because your femoral site is prone to infection. Additionally, all of these sites are prone to infection if the patient is obese. No? CBC plus obese increases the risk for infection. Okay? Obese patients increases the risk for central venous catheter infection. Okay, next. To confirm that the CVC is in proper place, X-ray ang gagamitin natin. So X-ray is used for confirmation. Okay? Now, we have different types of central venous catheter. We have your single lumen, double lumen, triple lumen, whatever. Tatandaan mo lang that no matter how many lumen pa yan siya, one lumen, one purpose. One lumen, one purpose. Ibig sabihin, if that lumen is already used for medication, you cannot administer nutrition in that one. Use another lumen or different site ka na. Okay? If that lumen is for parenteral nutrition lang, you cannot extract blood from that one. Use another site. One lumen, one purpose. Okay. Next, the lumen is at risk for coagulation, no? Yung central venous catheter. Therefore, it is very important to flush it with NSS or diluted heparin to prevent it from becoming clotted. Okay. So, to flush it, again, use your NSS or diluted heparin. Okay? The common complication of your central venous catheter would be air embolism. So, with air embolism, you already know how it works, diba? Yung positioning niya, yung mga maneuvers, etc. Yung Durant's maneuver. Next, for your peripheral central catheters, your PICC lines. So, a peripheral central catheter can be used in a hospital setting and in a home setting. So, can you discharge someone with a PICC line? Yes. Okay, pwede nilang i-discharge. Okay? So, The site of peripherally central catheters or PICC lines would be your basilic vein, cephalic vein, and median vein, but it's rare. Again, once the patient is obese, the most common problem with this one is infection na naman. No? Increases the risk for infection. The purpose for your PICC lines as well as your central lines, no, can be for fluid electrolytes, medication, blood transfusion, madami. Has a lot of purpose. Complication, no? The common complication of PICC lines is phlebitis. Okay? Phlebitis, so an infection. Again, you have to flush it with diluted heparin. So for PICC lines, the common complication is phlebitis. For central venous catheters, the common complication is air embolism. Yes, very good, no? Air embolism for central catheter, phlebitis for peripheral catheter. Ano nga yung, what is the site where it is at risk for infection in your central catheters? It's your femoral site. Very good. Okay. And what is our principle when it comes to central catheters? Ano yun? One lumen, one purpose. Okay? Huwag kakalimutan ha, one lumen, one purpose. Okay, next. Our next topic would be parenteral nutrition. Okay? So when it comes to parenteral nutrition, it can be partial parenteral nutrition or total parenteral nutrition. Partial parenteral nutrition can be given CVC or peripheral site, PICC lines, TPN, CVC only. So which of the following patients can you discharge? Yung may partial parenteral nutrition or yung may TPN? Sino ang pwedeng ma-discharge sa kanila? Si PPN or si TPN? Si PPN. Bakit si PPN ang pwedeng ma-discharge? Kasi ano yung kanyang line? Partial ay peripheral line. Okay, PICC line. So tatandaan ha, it might come out in exams, no? Which of the following patients you can discharge? TPN, bawal. Kasi central venous catheters should be used in the hospital only. Okay? So let's start with your partial parenteral nutrition. Partial parenteral nutrition, the only thing they can give are macronutrients such as carbs, proteins, and lipids. Now, this doesn't have a problem unless they are infusing lipids because lipid has an oily residue, no? Oily residue. So this is our nursing intervention when infusing lipids. Do not add water to the solution because fats and water, they don't mix. And pwede din mag-cause ng mga clumps. So don't add water, can cause clumps. Next, do not refrigerate. Diba? Ano nangyayari pag ni-refrigerate mo ang adobo? No? Take it out, there is a white layer of snow. Diba? Para na siyang tumitigas. So, same reason, because it can clump up. No? Don't use a filter line. No? Because the filter line, no, magka-clump up lahat ng lipid dyan. The lipid will clump up on that. It will act as if it's a grease trap. No? It will act like a grease trap. So, delikado siya. So, no filter lines. And also, check for oily residue on the tubing because the oily residue on the tubing can cause the tubing to deteriorate faster. Mas madaling masira. No? And the oily residue can attract bacteria as well. So, pwedeng magka-infection. Okay? So, it can cause infection and can destroy the tubings. Yan. Now, for TPN, total parenteral nutrition. So, because total parenteral nutrition na siya, it can cause, it gives macro and micronutrients. So, lahat na. It can give macro and micronutrients. Most common problem with this one would be hyperglycemia. No? Watch out for hyperglycemia in TPN. So, when monitoring a patient under TPN, you might notice blood sugar is high. That's not a problem. Common talaga yan sa kanila. However, It is not, it is a problem when the patient has hyperglycemia plus polyuria plus polydipsia and polyphagia. Because one of the adverse effects of parenteral nutrition is diabetic mellitus. So monitor mo yan. No? If they have hyperglycemia, that's okay, common. But if they are showing signs of diabetic mellitus, you have to report that one. Next, thrombus formation, another problem. So to prevent thrombus formation, use your heparinized needle, no, your NSS needle with heparin in it. Okay? When it comes to TPN, now there are certain professions that you need to collaborate with, such as your dietitian, no? Well, such as your dietitian, because dietitians, they can be in medical situations, no? Nutritionists, these are usually for general, mga public. Okay, so you have to collaborate with your dietitian because the dietitian is the one recommending it. Okay, endo. Well, ang doctor, they rely on the dietitian. No, they rely actually on the dietitian. So you would usually see a dietitian prescribing something, no, and then the doctor will just say, "Yeah, let's use this," no, because the dietitian is very expert in this one. Okay, so kaya sila yung collaborate natin si dietitian. Okay, aside from that, no, when it comes to TPNs, eventually you will wean the patient off. No, you want to wean the patient off. So to wean the patient properly, no, you slow down the TPN, slow down TPN, okay? And at the same time, you increase IVF fluid and oral intake of food. Yan. So, tatandaan ha, slow it down, to wean off, slow down, no? Do not stop abruptly because if you do stop abruptly, it might cause hypoglycemia, which is dangerous, no? Dapat mabagal, slow down. Okay? Any questions with your TPN, with your parenteral nutrition, and with any questions? Okay, no questions. Okay, let's answer the following. Okay. A client with a central venous catheter who is receiving parenteral nutrition suddenly becomes short of breath, complains of chest pain, tachycardia, pale, and anxious. Based on the clinical scenario, complete the sentence by filling in the blanks with the options provided. The nurse will perform blank, blank, and blank to treat the potential condition of blank. So what do you think is the potential condition of this patient? Is it air embolism, circulatory overload, central line associated bloodstream infection, infiltration, or phlebitis? Very good. It's your air embolism. Number one. Okay. So because it's an air embolism, what would we do? We need three nursing actions. 1-4. Okay, you're missing another one. No? Okay, so it's either you perform, ano ba to? Ay, sorry. So, apat pala. Dapat ano kasi ito siya. O yan, 1 hour. So, the answer is 1, 2, and 4. Ayun. So, mali kasi dapat monitor VS 1 hour dapat yan siya. So, clamp the catheter. Okay. Notify HCP and position the patient left Trendelenburg. Okay. So, ito yung tama. Any questions? Any questions so far? Okay lang ba? Hello? Do you need stimulants? Ayoko na po. Ayaw mo na? We're getting to the good part. Yay! Calculations! Woo! Okay, so magka-calculations na tayo. Pero don't worry, yung first part lang, okay? Ay, sige, break mo na. No, ako din, gusto ko din mag-break. Kasi, to be honest, ayoko din mag-calculate. No? Kaya ako naging nurse. Kasi ayoko mag-calculate. Kung gusto ko mag-calculate ako, nag-math major ako, di ba? Ayoko maging, ayoko nag kaya hindi ako nag-math major. No? Nurse ako. Malamang ganun din kayo. Nurse kayo kasi you didn't know na may calculation. Di ba? Oh, sige. So, let's have a 5-minute break and then let's pretend that we know math. Okay, so 5-minute break muna tayo and then calculations tayo. First part lang, no? Before we end today. Okay? Okay? Sige, let's start with the first part lang, no? Sandali lang. Mag-charge muna ako for a while lang. Okay, sige. Let's start with the first part of your calculations. Okay. So, ang i-discuss lang natin na would be your dosage calculations. Yung pinaka-simple, yung doctor's order over available times quantity. After that, tapos na tayo. Okay? Para ma-enjoy din naman yung ma-enjoy natin yung Friday, no? Friday na Friday, tapos nagbibilang tayo. Nakakapagod. Okay, so dosage calculations, ang kailangan natin, what we need to remember is the following formula. Doctor's order over available times quantity. It's that simple, okay? The only time this becomes complicated is when you convert. That's the only problem, when you keep converting. So therefore, no, ito lang yung assignment nyo, no? Just remember the different conversion, no? You don't remember, you don't need to remember all of this, of course. Delikado na yan, no? Ang dami-dami. You just need to remember yung most common. Pounds to kilograms, liter to ml, milligrams to nanograms, basic. Yung pinaka-basic lang talaga. Okay? Of course, wala na yung distance. Okay? Ano ba yan? No? Ito lang, no? Volume and weight, usually. Okay? That's where dosage calculation becomes complicated. It's when you start converting. But it is simple. And let me tell you, in your NCLEX exam, the calculations are very simple. Very simple. It only becomes complicated when you miss answering the simple questions. Okay? Kasi sa start, no, in the beginning, they will give you simple calculations. Pag namali mo yon, when you get that wrong, then they will start throwing harder, heavier calculations to you. So we have to pass the simple lang. Okay, so doctor's order over quantity. Let's answer number one. A patient who has a bottle of warfarin at home. If the patient has it at home, is it the doctor's order or the available dosage? Okay, it is the available dosage, di ba? So a patient has a bottle of warfarin, 5 milligram at home. So sulat mo na yan, that's your available. After his most recent INR, the doctor tells him to take 7.5 milligrams per day. Okay, so kung 7.5 milligrams, sabi ni doc, then that is a doctor's order. No, that's your doctor's prescription. So you put it up there. And then you divide. Very simple. 7.5 divided by 5, what would be the answer? 1.5 milligrams. Okay, 1.5 milligrams. Sige, practice on number 2. The physician orders alprazolam 0.5 milligrams PO. You have on hand Xanax 0.25 milligrams tablet. How many tablets will you give? So very simple. Sige. Okay? Without using calculations, no, alam nyo na mental math, 2 tablets yung answer. Okay? Because if you have 0.25 on hand, 2 0.25 will make a 0.5 milligram tablet. Okay. Sige, let's continue answering. Okay? A client is prescribed heparin, 6,000 units subcutaneous every 12 hours for deep vein thrombosis. The pharmacy dispenses a vial containing 10,000 units per 1 ml. How many ml of heparin should the nurse administer? Record your answer using 1 decimal place. Okay. Okay, sige. Let's answer. So, the prescribed, which is the doctor's order, is 6,000 units. So, I will put it as my numerator. Units. No? What is being dispensed by the pharmacy, which is, that's the available, is 10,000 units. And the quantity is 1 ml. So 6,000 divided by 10,000 times 1 ml, the answer should be 0.6 ml. Very simple, very easy. So let's try a weight-based calculation. Okay? So a weight-based calculation, tulad ni digoxin, ay di pa pala. Weight-based calculation will be later na pala. That would be tomorrow, sorry. So again, let's continue practicing. A cardiologist prescribes digoxin 125 microgram by mouth every morning for a client diagnosed with heart failure. The pharmacy dispenses a tablet that contains 0.25 milligrams each. How many tablets should the nurse administer each dose? Record your answer in one decimal place. Okay? So to help you out, for every 1 milligram, there is 1,000 micrograms. Okay, for every 1 milligram, there's 1,000 micrograms. Correct answer is, ayun, ang dami ng sumagot. No? And usually, that is the only problem when it comes with your dosage calculation. The doctor's order over available times quantity. No, it is only difficult when you start converting because you need to memorize other converting factors. Okay? So what is the correct answer? So, ganun pa rin, doctor's order over available times quantity. So if the doctor prescribes it, then that is the order. No, that is the doctor's order. So that's 125 microgram. No? But we need to convert it to milligrams. So you divide it by 1,000. Okay? So that is 0.125 milligrams. So pwede nang ma-divide. 0.125 milligrams divided by the available 0.25 milligrams. The answer should be 0.5. Okay? 0.5 milligrams. Okay. Sige. The only way, no, to become master in dosage calculations is practicing. Okay? Is to practice it. So let's continue practicing these 5 questions. No, 5 questions lang naman. Okay, first, the healthcare provider orders a patient to take 2 grams IV daily. You're supplied with 500 milligrams per ml. How many ml will you administer per dose? So again, you just need to convert grams to milligrams. No? So to help you out, 1 gram is equivalent to 1,000 milligrams. Okay. So 2 grams is 2,000 milligrams divided by 500 milligrams, no, per ml. So that's 1 ml. So 2,000 divided by 500, that's 4. Very good. You got the answer, 4 ml per dose. The healthcare provider orders the patient to take 6 grams PO daily. You're supplied with 3 grams capsule. How many capsule will you take? 6 divided by 3, 2 capsules. Galing naman, no? Ano ba kayo? Are you a math major? Hindi, nurse pala. Bakit ang galing niya? Okay, sige, let's continue. The physician writes an order to administer an oral medication. The order says, administer 25 milligram by mouth, BID. Okay? Pharmacy dispenses you with 50 milligram tablet. How many tablets do you administer per day? Okay? The answer is 1 tablet per day. Okay, so how did we get it? Okay, so again, administer 25 milligrams BID, so twice a day, no? And the pharmacy dispenses you 50 milligrams per tablet. So again, 25, no? Divided by 50, okay? 25 divided by 50, no, it's 0.5. But for the entire day na yan, so 0.5 plus 0.5, 1 tablet. Okay? 1 tablet. So kung pwede din gawin nyo 25 milligrams BID, so twice a day, so 50 na yan siya. 50 divided by 50, 1 siya. Okay? So very simple, very easy. And no? In honesty, ganito lang kasimple lumalabas sa NCLEX. They ask very simple, tawag yan, very simple um, calculations. The only time it becomes difficult is when you miss it. No? Pag hindi mo nasagot yung calculation na yun. Okay? Some test takers do not even encounter calculation questions. No? Some test takers don't even encounter calculation ng mga question. That is why calculation is not a big deal when it comes to NCLEX reviews. No, when it comes to pharma, hindi siya big deal kasi not all encounters it, no? Ang iba, ang pharma nila is about side effects, adverse effects, which is the most common. But in case lumabas, the most basic lang talaga, no? Ang kailangan malaman. No need to bring calculators. Ang calculator natin, ano na, prepared na siya. Ano na siya, it is already given to, built-in na pala yung calculator. No? Nasa NCLEX exam na mismo siya. Merong calculator dyan na symbol. And click mo lang. Okay, so, yun, simple lang talaga. It is only complicated with conversions. That's the only problem. Sige, let's continue practicing. The physician writes an order to administer oral medication. The order says 2 milligrams by mouth once daily. No? The pharmacist dispenses 1 milligram per tablet. How many tablet do you administer per dose? No? Hindi na per day, per dose na. Okay? The answer is, very good, 2 tablet per dose. Oh, last. MD writes an order for Mucomis 300 milligrams by mouth. 1 dose before the heart catheterization. Pharmacy dispenses 600 milligrams per 2 ml. How many ml will you administer per dose? Answer is 1 ml per dose. Okay, so how did we get it? Now 300 divided by 600, no? Tapos times 2. So 1. 300 divided by 600 times 2 ml. So the answer is 1 ml per dose. Oh, naging mukha na siya. 1 ml. Yeah. Okay? Sige, before we end, let's answer this question. And if you get this question right, ibig sabihin, you were listening all along. Okay. The primary care provider prescribes 5 ml of medication to be given at deep IM for a 40-year-old female who is 5'7" tall and weighs 135 pounds. Which of the following is the most appropriate method of administration? So baka medyo tricky to siya. Pero I know you have been listening, so you will get this answer. Is it number 1, a tuberculin syringe, 25 to 27 gauge? Number 2, 3 ml syringe, 20 to 23 gauge. Number 3, 2 ml syringe, 20 to 23 gauge. Or number 4, 2 ml syringe, 25 gauge. Very good. The correct answer is number 2. No? If you are given 5 ml, then you need 3 ml. No? It doesn't matter how tall or how heavy the patient. You need 3 ml to make 6 ml para mag-fit ang 5 ml. Additionally, there is no 3 ml syringe out there. There is no 2 ml syringe. Okay? So very good. No? A lot of people get this wrong because they don't listen. Okay, kayo nakikinig kayo. And I'm proud of that. So thank you very much for attending our first part. Tomorrow we will continue with our calculations. No? With our calculations, kasali na ang IV flow rates and ang weight-based calculations, which is, yan yung medyo nakakapagod. Okay? So it's a Friday today. No? Enjoy the Friday, enjoy the weekend. And after you enjoy the weekend, then review na naman kayo. Okay? No exam. Our exam would be on the last day. Our exam is a very long one. So last day talaga yan siya. Okay? So thank you very much and I'll see you next time. Bye-bye. Ingat.
Thank you so much, Sir Greg. Nurses, tomorrow, pharmacology continuation po. So, see you tomorrow, nurses. And kindly don't forget, evaluate the lectures po. And if ever po na may concern po kayo, kindly fill up lang po dun sa concern po natin. So, thank you so much po and God bless po. Thank you, Sir Greg. Thank you, nurses. Bye-bye po. See you tomorrow po. October 14.